Okay, this is Mark of Ultimate Performance Training, and we are treating
everything.
This stuff. So I had Mark on my dummy mark what is hurting on him, and so starting from the top left, we got the left bottom part of the ribs, pain in TFL glute area on the left, left patellar pain, fibular pain, heel pain, second and third metatarsal pain, and then both hip flexors and big toe on the right. So then we kind of screened everything, and that's kind of this lower right hand corner here. So MS flexion, that stands for multi-segmental flexion, so just imagine you're reaching down to touch your toes, and we found he had very little lumbar spine flexion. It just stayed flat, so that his upper back had to round. And then he reported a decrease in tension when he let his head down. So we checked his slump, which is a measure of neural tension, and extension, and we found more tension there. So that's one of the things we're going to look at. Then the multi-segmental extension, he had very little forward weight shift, and he kind of hinged in his lower lumbar spine where he tends to have pain. His shear is just imagine standing in a genie pose, and your hips go to the right and then to the left. No real pain there, but just hard when I give him over pressure. So just probably some soft tissue mobility. Then the vertical compression, that's just 5/5 would be maximal strength, and so I gave him a 1/5, so I couldn't ever correct him to the point where he could have good stability there. So probably more of a mechanical issue. And then the elbow flexion test is kind of a continuation of that, just seeing his bicep strength, I guess, in with resistance. So I just gave him poor trunk and scapular initiation, meaning he couldn't turn on those deep stabilizers. So then above that, the dummy is kind of some of the stuff that we found. So probably the biggest mechanical limitation is in both ankles, and then hips. He had some impingement when he goes into kind of that pinching when he goes into hip flexion, and then very generally limited extension other than where he hinges in his lumbar spine. So on the right upper hand corner, the priorities for today. So neuromuscular control and especially flexion. So one of the things we noticed when he was on his back, when he lifted up his leg, is he immediately extends his lumbar spine and has trouble engaging there. Extension mobility, where he tends to hang out and compress on the lumbar facets and then work on the foot to give him more mobility. Okay, so we're done, and big things we treated. There's my priorities over there on the right. So first thing we started was working in sideline PNF. So developmentally rolling is really important for getting your abs to kick in first. So we spent a couple minutes working on rolling and really getting his core engaged well. And then we worked on the hips just a little bit, working on the front part of the hip flexors and freeing that up, and then freeing up some of his low back, quadratus lumborum. I think that's it. And then worked on freeing up feet, and so Mark's gonna tell us what he feels.
Well, I feel amazing. Didn't feel too great when Nick was treating me at the time. It hurt like crap because my body is made of concrete. The nice part is I feel amazingly better. I squat better, lunging better, not having pain in the left side of my leg and hip anymore. He cleaned up my big toes, which were just a gigantic mess. And really the low back, everything just feels looser. I feel like I can do things a lot easier. So I know that my day throughout, basically I know that going throughout my day is going to be a lot less challenging and basically demanding on my body. So that's a win-win. So if you haven't been treated by Nick, you're an idiot, because you need to be, because Nick's the best at what he does. There really is no other physical therapist or manual therapist that's like him, or really is good as what he does. So if you haven't seen him yet, if you have aches and pains or any sort of just a nagging annoyance, get to see him immediately and give him a call.
Thanks, sir. So while I'm stuck in traffic, I just wanted to illegally recap what we did with Mark. Mark is one of the very motivated clients that's always working on rolling himself out. He's on his lacrosse ball beating himself up because his soft tissue is so tight, but it always comes back, and so we were really looking for something underneath that, to the cause of why do all these things keep coming back, and why is it turning into more of a chronic whole leg issue where it used to be maybe his knee. So the really important thing that I think was important for him and to help all the benefits carry over is the PNF that we did. So working on what we call mass rolling. So really to engage and get his nervous system primed so that when he in a functional activity is moving his extremity around, his spine will be stable, so that he won't have the soft tissue restrictions coming back because they're trying to basically protect things. So we moved from there into the low back just because he does need a lot of soft tissue work and joint work to free that area up, but the big thing to help that carry over will be his rolling, and I gave him some things to take home with that, so that he could make those things kick on a little better and be a little stronger, and then carry over into his functional activities. So I'll give you an update when he gets back to me after it's been a couple days. Thanks again for watching this entire video. I appreciate your time. Next time I'll try to get some extra hands so you can actually see what a treatment looks like. I think it's important. A lot of physical therapy, in my opinion, gets a little tunnel vision, and where your knee hurts, they treat your knee, and I think it's really important to treat your body as a system, because probably a lot of Mark's toe pain could trace back to what's happening at his pelvis and spine. So next time I'll try to get another hands, but so you can get an idea what that looks like. But I do appreciate you watching my video. You can find me on my website at www.atx-pt.com, and I would look forward to hearing from you. Thank you.